Let's grab our foam roller and we're going to bring our purple loop band around our outer thighs. That's the purple loop band. We'll come onto our knees with the shins and the tops of the feet on the ground. I'll be profile to you so that you can see what's happening with my torso. So I'm going to create a diagonal for my knees out through the crown of the head, neutralizing my pelvis, so that's somewhere between rounding and arching the back, pulling the belly in towards the spine, lifting in and up on the muscles that stop my stream of pee. Knees are hip distance apart, shins and tops of the feet are pressing into the floor. I'll inhale, taking the roller overhead, hinging back. Exhale, turn my head right, left, right, left. Inhale, pause, centering the head. Exhale again, turn the head right and left, right and left. Inhale, back up to center. Roller comes back in line with the chest. And exhale, inner thighs pull you back into the diagonal. Inhale, prepare. Exhale, turn the head right, left, right, left. Inhale, center. Again, exhale, turn the head right, left, right, left. Inhale, back upright. Continuing, inner thighs pull you back. Belly braces in, lifting in and up on the muscles that stop the stream of pee as you turn the head. Inhale, pause. Exhale, turn the head. 2, 3, 4. Again, inhale, back up to center. Exhale, hinging back. Inhale, prepare. Exhale, turn the head. 2, 3, 4. Inhale, center. Exhale, back upright. Keep that going. Pulling the navel in towards the spine, lifting in and up on the muscles that stop your stream of pee, fogging a mirror with each exhale, making sure the belly is pulled in, the shoulders are plugged down. Imagine imaginary hands on your shoulder blades and bring the back ribs towards those hands, engaging your upper back here. Plug your shoulders down. Keep going. So we have 2 full breaths at the bottom, and on each exhale, we turn our head. Shoulders are plugged down. We reset, feeling our pelvis ground towards the floor on the inhale. We brace our abs and turn our head on our exhales. Keeping that going, opening up, stretching the thighs, engaging the lower pelvic floor muscles, kegeling to sustain the lift of the lower pelvic floor for the duration of each exhale. Finish up the one you're on. And we'll keep the purple loop band on. And from here, we're going to come onto our roller lying supine. Our tailbone will be at the bottom, our head at the top. The purple loop band is a little lighter than the gray from level 1. So we're relying more on our core than our legs as we continue to strengthen our internal muscles of the core. So 2 options. First option, the arms are in a chicken wing position. You're going to bring one hand to the ground and the other will stay in this cactus position. You can take one leg up, and that would be the opposite leg of the arm that's up. So if you have your right arm in cactus, your left leg will come up. And if you have your left, your right leg will come up. So this is the first variation. We'll be pulling that chicken wing elbow to the side of the body, and at the same time, lowering the leg, lifting the leg to bring the arm back into cactus. Lowering and lifting together. So that's the first option. If your balance is pretty good and you want to try the second variation, you can take both legs up and you'll move that opposite leg down as the arm goes down to the side of the body in your chicken wing position and then back to center. Taking it down and back to center. So just keep that going on your first side, breathing as you're working. The 2 variations are there. If you're unable to support the movement with those lower abs, make sure as you lower, you exhale. As you lift, you inhale. You feel your pelvis pulling towards the wall in front of you, lengthening on each inhale. You feel your inner thighs and pelvic floor muscles lifting in and up on your exhales. Let's go ahead and switch sides. So that'll mean switching the arm that's doing the chicken wing motion, pulling the elbow to the side of the body, and the leg that is lowering and lifting. Again, exhale to lower, inhale to lift. And both variations are going to work the deepest layer of your core. They're going to activate the hamstrings, They're going to activate under the armpit where the lat attaches as you pull that elbow to the side of the body, opening up the front of the shoulder and the pecs. If you feel gripping in the front of the shoulder, try to soften there. Imagine your shoulder blades pinching the roller. Plug the shoulders down. Soften the facial muscles. Widen the distance between the chin and the chest. And keep going. Breathing in and exhaling out. 2 more. Inhale. And exhale. Again, inhale. And exhale. From here, we'll make our way onto our knees on the roller. So we're going to flip around onto all fours. If you were kyphotic, lordotic, or lordosis prior to pregnancy, then I want you to keep this band on. If you were sway back or flat back prior to pregnancy, take the band off and bring the small anti-burst ball between your inner thighs. Okay, so we either have on the purple loop band or we have the ball between our inner thighs. Our knees are going to rest on the roller. We're going to let our shins come up into the air. We'll point our toes, wrist under shoulders, knees under hips. Now, a bit of the shin is on the roller, so you're not quite on your knees, you're a little more on your shins. We're going to be pulling the knees in a few inches towards the chest and then right back under our hips. So it's a very small motion, maybe 5 inches in, 5 inches back to neutral. It's a reverse crunch. I want you to maintain a neutral position with your pelvis. That means I don't want you rounding your low back as you pull the thighs in. We're pulling from our legs and abs, not from our upper body. So we're driving and initiating from our core and lower body. So inhale, exhale, we pulse in. 2, 3, 4. Inhale, exhale, and pulse. 2, 3, 4. Very simple. Toes are pointing. Inhale. Little mini pulses. 2, 3, 4. And inhale. Pulse it. 2, 3, 4. Continue on like that. I want you to imagine hands hovering above your shoulder blades. Try to bring your upper back and back ribs towards those hands, keeping the shoulders plugged down, the chin lifted, the belly firm in towards the spine. Watching out for rounding in the low back. It's really easy to do as you drive in from your core and your lower body. But can you tilt your pelvis back, pulling in the low abs, lifting up on the muscles that stop your stream of pee, doing those Kegels that will keep you in great shape after pregnancy. Just another 15 seconds here. Hang in there. This is a challenging exercise meant to target the lower pelvic floor and get that low belly back to its pre-pregnancy position, nice and flat. 1 more. Excellent. From here, we're going to keep this purple band around our thighs. If you had kyphotic, lordotic, or lordosis prior to pregnancy, you can keep the ball between the knees if you had sway back and flat back. We need our blue Theraband. That's the blue Theraband. We'll bring it around the arches of our feet, sitting up tall. Neutralize your pelvis, so somewhere between rounding and arching. Sitting up tall, you'll wrap the ends of the Theraband around your knuckles with the thumbs on the outside. We're going to inhale, prepare, exhale, hinging back halfway. Give me 2 rows. 1, 2, pause, inhale, feel your pelvis reach towards the floor. Exhale, turn the head right and left. Right and left. Inhale back to center, up to a tall spine. And we repeat. Exhale, hinging halfway back. Soften the front ribs towards the back ribs. Plug the shoulders down 2 rows. Inhale, prepare. Exhale, turn your head right and left. Right and left. Inhale, center pelvis grounds down as you come back up to a tall spine. So again, neutral pelvis, hinging halfway back. Imagine hands on the shoulder blades. Bring the back ribs towards those hands. And turning the head right and left. Right and left. Inhale, center, all the way back up to your tall spine. Continue on. You have another 30 seconds here to get in as many great sets of these hinge backs for your full abdomen with rows for your upper back strength, head turns to release the tight scalenes in the neck, the side of the neck, shoulders plugged down. Keep imagining those hands on your shoulder blades. Puff the back ribs into those hands. Keep breathing. Inhale. And exhale. Good. Everybody come up to the top. Final set together. Exhale, hinging back. 2 rows. Inhale, pelvis drives down. Exhale, turn the head. 2, 3, 4. Inhale, center all the way up to a tall spine. Great job. Moving over to a wall, we'll bring our 3-pound weight. And you can keep the purple loop band around your outer thighs. We'll sit against the wall. If it's more comfortable for your back to have the foam roller under your knees, you can do that, or you can sit with your legs just extended in front. Make sure the low back isn't rounding. Hold the 3-pound weight in your dominant hand, bringing your upper back against the wall. Wall cactus is here. So let me see that wall cactus. Dominant hand has the 3-pound weight. Imprint the back body, the mid back, the upper back, the backs of the arms, wrists, knuckles, tailbone, head. And once you've found that nice imprint, softening the front ribs, breastbone, and sternum towards the back ribs pressing into the wall, we'll slide the arm that's loaded with the weight up. Inhale, 2, 3, 4. Exhale, lower it down. 2, 3, 4. Inhale, slide it up. 2, 3, 4. Exhale it down. 2, 3, 4. Keep going up. 2, 3, 4. And down. 2, 3, 4. One more. Up. 2, 3, 4. And down. Keep your imprint. Pass the weight to your non-dominant arm. Find your imprint again. Mid back, upper back. Backs of the arms. Knuckles. Head. Tailbone. Belly firm. And begin lifting the arm up. 2, 3, 4. Exhale, it lowers. 2, 3, 4. Inhale, feel your pelvis ground down as it goes up. Exhale, inner thighs pull back towards the wall as it lowers down. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. 2 more. Inhale. 2, 3, 4. And exhale. 2, 3, 4. One more. Inhale. 2, 3, 4. And exhale. 2, 3, 4. Folding over the legs, taking a nice release. If you have any back issues and forward folding bothers the back, I'll give you another variation. But if forward fold feels nice, stay here. Other variation for individuals with back issues, cat and cow. Rounding and arching, moving through spinal articulation. And I would advise inhale to round this, inhale to arch, cow pose, inhale. Exhale, rounding. Inhale, arching. Exhale, rounding. Wherever you are, make sure you're breathing, enjoying moving through that posture or deepening into that forward fold. Another 15 seconds. Stay with it. Keep breathing. And 5, 4, 3, 2, 1. Make sure you have the purple loop band around your outer thighs. From here, we're going to take our red Theraband for some scaption, bringing it under the knees, pinning it. And we'll do unilateral work, sparkler arms with some circling out from the top of the shoulder sockets of the arms. So dominant arm working first. Inhale it up. Exhale, circle. 2, 3, 4, and lower. Inhale, lift. Exhale, circle. 2, 3, 4, and lower. Make sure the top of the feet and the shins are down on the floor. Knees are driving down. Low belly's firming. Front ribs are reaching for the back ribs. Shoulders are plugging down. Check in with all of those checkpoints. They're very important. You've got another 15 seconds on this side. Hang in there. If you need to stop and just roll your shoulder back because you've had enough, feel free to do that. But I'm going to count you down in 5, 4, 3, 2, 1. Switching to the non-dominant arm. Taking it up, circling it out. 2, 3, 4. Lower it down. Inhale, lift it up. Exhale, circle it out. 2, 3, 4, and lower. That's all it is. Inhale, take it up. Exhale, circle. 2, 3, 4, and lower. Again, inhale, lift. Plug the shoulder down. Keep your focus up higher than eye level. Exhale, circle. 2, 3, 4, and lower. As you continue, feel your pelvis grounding down on each inhale as if someone has their hands holding the pelvis and they're driving it towards the floor. Pull the low belly in. Tug in and up on the muscles that stop your stream of pee and try to keep your pelvis neutral. Make sure it's not arching and it's not tucking under like a scared puppy. Just another 5, 4, 3, 2, 1. Setting that red Theraband to the side, we can now come to lie on our abdomen, hands by our chest. Plug the shoulders down, pull the navel in towards the spine, tug in and up on the muscles that stop your stream of pee, and slowly press yourself up to upward facing dog. Inhale, exhale, turn your head. 2, 3, 4. Again, inhale, pause, and exhale, turn the head. 2, 3, 4. Inhale, and exhale, lower down. Keep that going. Inhale, pressing up, and exhale, turn the head. 2, 3, 4, and lower. So hold on a second. Let's shake the hips side to side just to get the kinks out of the low back. Make sure when you're up in this position, your thighs are lifted. You're getting a stretch in the hip flexors. If you feel pain in your low back, just make sure the belly's pulled in and you're lifting up on the muscles that stop your stream of pee. Let's come back up. Inhale. Exhale, turn the head. 2, 3, 4. Inhale, pause. Exhale, turn the head. 2, 3, 4. Inhale, center. And exhale, lower down. 2 more sets. Inhale, lift. Exhale, turn the head. 2, 3, 4. Inhale, center. Exhale, turn the head. 2, 3, 4. Inhale, center. Exhale, lower. One more time, belly firm. Inhale, lift. Exhale, turn the head. Inhale, center. Exhale, turn the head. Inhale. Exhale, lowering back down. From here, taking off the purple band that's on your outer thighs, grabbing your orange loop band, the lightest loop band in the YouniquelyFit kit, bringing it around your outer thighs, and your 3-pound weight. We'll come to lie in a fetal position with our small anti-burst ball under the side of our head. Neutralize your pelvis somewhere between arching and rounding. Plug the shoulders down. Top arm is going to find a right angle, holding the weight. Wrist flat, elbow glued to the side of the body. Top leg is going to hover up. We'll externally rotate the leg from the top of the hip socket as we lift the forearm up simultaneously. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. 2 more. Inhale, 2. Keep your wrist flat. Keep the elbow pinned. 1 more. And from here, we'll slowly make our way up, finding our fetal position, head supported on the other side, shoulders plugged down, neutral pelvis, belly firm, legs stacked, toes pointed. Lift that top leg up, glue the elbow to the side body, forearm flat, wrist flat. Here we go. Lifting up, 2, 3, 4, and lowering down, 2, 3, 4. Try to not roll or rock back. The rotation of the leg is from the hip socket. The torso stays nice and still. The forearm is lifting up. Wrist is staying flat. Keep going. 4 counts to lift on your inhale. 4 counts to lower on your exhale. Think about the energy lines in the body on your inhale, that pelvis reaching down to whatever is below it, towards the bottom of the mat. You have another 20 seconds here. Utilize your time to build strength in the outer hip, in the external rotator cuff, in the lower pelvic floor, working on that pelvic stability. Counting you down. 5, 4, 3, 2, 1. Great job. Let's move into some lower body work. We'll need our yellow Theraband and our foam roller. We're going to take our arms into a diamond position so that we can do chicken wing arms with one arm at a time. We'll start with our dominant arm, bringing our feet onto the roller in a wide leg bridge position like your feet were in the stirrups at the gynecologist. So from here, we'll inhale the pelvis up. And as we tap it down, we will pull our cactus arm in by the side of the body. And then we'll slacken it up on it as we send the hips back up. Inhale. And exhale, pulling down, elbow to the side of the body. Again, inhale, pelvis up. Exhale, pulling down. Inhale, pelvis up. Try to not move the roller. Wrap your toes around it like a bird would around a branch, pointing them. Knees tracking over the second and third metatarsals. Give me one more. And other side. So I've wrapped around my knuckles with the thumb on the outside. And yes, the band may hit your head, but it's not going to hurt you. It's all about engaging the back of the shoulder. See if you can imprint and fight for the front ribs to meet the back ribs and press the back ribs heavy into the floor. The closer those feet are to the butt, the more you'll feel the glutes. The farther away, the more you'll feel the hamstrings. So depending on where you'd like to work, the feet can be farther away if you want it more hamstring focused, closer if you want it more butt glute muscle focused. Okay, so here we go. Let's begin on the other side, the other arm, that chicken wing position. Inhaling to lift up into your bridge. Exhaling to pull down into that chicken wing as the pelvis taps down. Inhale, lift up. 2, 3, 4. Exhale, pull down. 2, 3, 4. Inhale, lift up. 2, 3, 4. Exhale, pull down. 2, 3, 4. Keep that going. Inhale, lift up. 2, 3, 4. Brace your abs. Exhale, lower down. 2, 3, 4. One more. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. Set the yellow band to the side. Grab your red Theraband. Now, if you had sway back or flat back posture prior to pregnancy, you can use the anti-burst ball between your inner thighs. It'll look like this. If you had kyphotic, lordotic, or lordosis, bring the purple loop band around your outer thighs. That's my posture, so I'm going to put that on. We're going to take the red Theraband under our bum, gathering the ends of it in both hands, wrapping around the knuckles with the thumbs on the outside. We'll pull out, engaging our upper back. Hands will still stay on the ground, but we're actively pulling out on that band. Our bridging this time is going to be neutral, so we're going to have our legs parallel, hip distance apart. And you either have the ball in between your inner thighs or you have the purple band on so you feel the outer lateral chain of the legs as you lift up. Let's everybody lift up, pulling out on that band, holding it up. Inhale 1, breathe. Exhale 1, 2 breaths. Inhale 2. Exhale 2. Inhale and exhale, slackening in on the band as we tap the pelvis back down. Again, inhale, picking the hips up. Exhale, holding it up. Inhale and exhale. Inhale, exhale, tap it down. And inhale, pick it up, hold it up. Exhale the air out, bracing the abs. Inhale, feel the pelvis reach forward. Exhale, feel the inner thighs pull back, stabilizing you. Use your toes. Pull out on that band that's under the bum. Hands heavy on the floor. Shoulder blades pulling down towards the roller. Collarbone wide. Tap the tailbone down. Final set. Lift it up. Hold it up. Inhale 1. Breathe. Exhale 1. Inhale 2. Exhale 2. Inhale and exhale. Tap the tailbone down. Let's everybody, you can place the ball to the side if you have the ball and that red Theraband. We'll drape our knees over the roller And we'll do a little footwork here. So for kyphotic lordotic, E version from the ankle joint, circling away from the body. Inhale, exhale, circle away. 2, 3, 4. Inhale, pause. Exhale, circle away. 2, 3, 4. Sway back posture, the opposite. So if you had sway back posture prior to pregnancy, inhale, exhale, circle in towards the body. 2, 3, 4. Again, inhale, exhale, circle in. 2, 3, 4. And our flat back posture, dorsiflexing the feet actively on your exhales, relaxing the feet on your inhales. Looks like this. Dorsiflex, 2, 3, 4, and relax. 2, 3, 4, and dorsiflex, 2, 3, 4, and relax. So we have a pausing component where we're not working, and we have our moving component, either flexion, dorsiflexion for flat back, inversion, turning the feet in towards the body for sway back, eversion, turning the feet away from the body for kyphotic lordotic and lordosis. So I've demonstrated all of them. You keep going. We've got another 30 seconds here just to work those feet before we come up to stand and begin our cardio in a bit. So keep that going, using your breath. Another 15 seconds. Inhale, pause. Exhale, move. Inhale, pause. Exhale, move. Last set. Inhale, pause. Exhale, move. Final lower body exercise in our lower body strength work. We're going to, if you had sway back or flat back prior, keep your anti-burst ball between your inner thighs. We need our red Theraband again. Lordosis and kyphotic lordotic, put the purple loop band around your outer thighs. Okay, so prior to pregnancy, if you were lordotic or kyphotic lordotic, purple band. Anti-burst ball if you were sway back or flat back. Now, if you don't know, both exercises are fine. Just think about your feet. Do you roll in or out more? If you roll in, you're going to want to use the purple band. If you roll out, you're going to want to use the ball. If you're kind of in the middle, you can try both variations. So from here, the red Theraband is now going to go over our thighs. We'll wrap around both hands, knuckles with the thumbs on the outside, and we'll push the hands down, creating some resistance as our pelvis goes up. We'll extend our legs long on the roller, and we're going to do some hamstring curls. We'll inhale, lifting up, going in and out 2 times, and then lowering the pelvis back to the floor. So inhale up, exhale out. Inhale up, exhale out, and lower. Again, inhale, lift. Exhale out, inhale up. Exhale out, inhale up, exhale, lower. And really push down with the hands. You'll notice that that red Theraband creates nice resistance. It also helps with a little counterbalance. So it's a nice tool to use. You've got another 20 seconds here. Make them count. Legs are hip distance. You're rolling over the heel, up onto the feet, and then back over the heel. Keep it going. 2 at the top, and then you lower. Shoulders plugged down. Use your abs. Neutralize your pelvis. Soften your facial muscles. Press the back ribs into the floor. Finish up the one you're on. And let's set all of our props to the side. Take off the loop band if it's around your outer thighs. Come to a comfortable seated position. If you have no back issues, take a forward fold over the legs, pointing the toes. If you have back issues, find your way onto all fours. Now, if you have knee issues, I'm going to give you another option. All fours, begin your cat and cow if it's back issues that you suffer from. Inhaling to come into cow, exhaling to round. And if you have knee issues, you can do this cat and cow position with your hands on a chair. I'll show you that variation now. So lots of different variations to keep you safe and feeling good as you're working here. Another 30 seconds, hands on the chair. I'm showing you this variation, but you can be folding over the legs if you don't have knee or back issues. You can be in cat and cow if you just have back issues. And if you have knee issues, you can do cat and cow with the hands on the chair. So keep that going. Another 20 seconds, using your breath, getting into the flow of it. I like to cow pose when my chest and chin are lifted and tailbone's up. Inhale and round on my exhale, bracing my lower abdominals. Give me a couple more breaths. Great job. We're going to move into some opening stretches before we begin our level 2 cardio burst. I'd like you to grab a bolster or yoga block or pillow, and we're going to come onto our knees, coming into a kneeling position. Start with your non-dominant leg forward. So that's your non-dominant leg forward. You'll place the bolster, block, or pillow under that side's hip, moving into pigeon. The front leg shin can be parallel to the front of the mat, or it can be in towards the groin with the toes pointed. The back leg should be solidly on the floor, top of the foot on the floor, toes pointed. Bring the hands to the side, to your hips. If you need yoga blocks, you can have yoga blocks in each hand pushing into the floor. But from here, I'd like you to interlace your hands behind your back, balancing up. So that's why you definitely want the bolster under your pelvis. Opening up the chest, inhale. Interlacing those hands, letting the shoulders open. Exhale, bracing the abs. And inhale. Exhale. 3 more breaths here. Inhale, sitting up tall, pelvis grounds down. Exhale, inner thighs pull you back up tall. Inhale, pelvis pulls towards the floor. Exhale, inner thighs pull back. 1 more breath here. Inhale. And begin to walk your arms forward, coming into that fold. Breathing here, trying to find a neutral pelvis. 6 breaths. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Inhale 4. Exhale 4. Inhale 5. Exhale 5. Inhale 6. Exhale 6. Taking the hands to the side, making your way back onto all fours to your knees, back into your kneeling position. Switch the bolster to the other side. Coming down into your pigeon, pointing your front foot's toes, resting that back leg down on the floor, relaxing the top of the foot on the floor, pointing the toes as well. Interlace the hands in the funny way behind your back, so switching the grip, opening the shoulders, plug the shoulders down the back, lift the chin, soften the front ribs towards the back ribs. Inhale, pelvis grounds down. Exhale, inner thighs pull back. 2 more breaths here. Inhale, pelvis grounds down. Exhale, inner thighs pull back. 1 more breath. Inhale, pelvis grounds down. And exhale, inner thighs pull back. Walking forward into your pigeon pose. We'll be here for 6 breaths. Here we go. Inhale 1, breathe. Exhale 1, fight for a neutral pelvis with your abs engaged. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Inhale 4. Exhale 4. Inhale 5. Exhale 5. And 1 more. Inhale 6. Exhale 6. Slowly making your way up, setting that bolster to the side. We're going to need our purple loop band around our outer thighs. And we will place our stair stepper down. We'll grab our green loop band to put around our wrists. And we're going to be moving in the frontal plane up and over our stair, our step. But if you're doing this on stairs, you can just go up and down and then switch sides and do the other side if you don't have a stair stepper. But stair stepper is a great investment. Stairs are also fine because this exercise would work fine. You just do one side and then do the other. So watch me this first exercise and then join me at 50% effort. So the arms are going, bending at the elbows, going overhead as I step up onto the box, and then I step back down. I have this purple loop band around my outer thighs to feel the abductors of the legs, up and over. The green loop band I'm pulling out on a little bit as I bring the arms overhead, And as I lower off the box or down to the floor if I'm using steps, the elbows bend. Simple exercise meant to get your heart rate up. Just go at 50% effort right now, learning it. Turn around, try it. Well, you don't even need to turn around because you're going up and over. But you do need to turn around if you're working on a step. So if you're working on a step, go ahead and turn around. Practice the other side, stepping up on the other side, because there's always a side that's a little easier. And notice when you step up if your foot is perfectly parallel or if you're turning your foot out or in. You want to work with a parallel leg in the hip socket, meaning your foot will also be perfectly parallel, and your knees always step up with a soft bend in the knees. Don't lock your knees out. Bad for the knee joints. Okay, that's our first exercise. Our second exercise, we're keeping the purple loop band on for all sets. So you don't have to worry about taking that off. Keep that on. Grab your 3-pound weight. So in level 1, we held it at our chest. In level 2, when we turn in the transverse plane, we're going to lift and lower, kind of about as high as the chest. Don't take it above the shoulders because that pulls on the shoulder joint, and it's going to be far away from the body. So it'll look like this. We're going to go up and over. We'll alternate sides. So if you have a stair you're working on at home, this will work just fine on the stair. So up and over, and then we go right back on the other side with the arms coming up into that scaption position, holding the 3-pound weight. You're holding the heads of the weight in each hand, and it swings up. And try to not think about swinging per se, but lifting. So as the weight goes up, your shoulders plug down. Make sure you're only doing this exercise at 50% effort. I don't want 100% effort yet. And as the arms swing, you must keep them below the shoulders. So I really want to emphasize this for your shoulder safety because there can be tightness, and we definitely don't want to be swinging weights really fast once we start going at 100% effort. So keep that slow. Okay, our next exercise. We're going to need our 3-pound weight and our green loop band. We'll keep the purple band around our outer thighs. And start with the 3-pound weight in your dominant hand and the green loop band around your wrist. You'll pull out on it. The arms will lift up as you step up onto the box. And I want the opposite leg of the arm that's loaded with the weight stepping up. So that one steps up and that one steps down. So we change our leading leg. So I'm left-handed, which means my right foot will step up first when my left hand is loaded. So I go up, up, down, down. So right, left, right, left, right, left, right, left. So I keep it really simple. And then when I say switch and you take the weight I take the weight in my right hand, it'll now be my left leg that's leading. So left, right, left, right, left, right, left, right. And the arms are going up in front just like they did in the transverse plane when we were turning. So really working on that scaption and knowing when to stop those arms, being able to plug the shoulders down and only take the arms up a little below the shoulders, chest height about. Okay, so we're going to keep that going. Sagittal plane is just forward and backwards movement, up and down. This works great on a step as well. So now we know all the exercises. We're going to begin our cardio burst, and what I'd like you to do is give me 100% effort. I'll remind you of the exercises. We have 50-second breaks between our exercises. So the first one was our up and over, the frontal plane. If you are working on a stair, then the first set we'll do on one side and the second set we'll do on the other. So you don't need to switch in the middle of the set. So the purple band should be around your outer thighs, the green loop band around your wrist, and just watch me up and over. The arms go up as I go up, and they come down as I go down. Get set up, counting you in 3, 2, 1. Here we go. Give me 100% effort. 1 minute on the clock. This is for your heart health. This is to condition your body post-pregnancy. Low impact for your joints to keep you safe, but important for your heart health, stress management, anxiety management. You have all of this new stuff happening after having a baby, and you need to be able to handle it mentally. So your heart health is really imperative, and your mind's health. So think about this as excellent training for your mental health as well. Give me 100% Make sure your legs are parallel, feet are parallel. You're not stepping up to that box and locking out in your knees. You're keeping your knees nice and soft. 10 more seconds here. Push yourself. How hard can you go? Give me your very best. Counting you down. 3, 2, 1. 50-second break here. Grab water. If you're using a regular if you're on stairs, you're going to turn around on this next set and repeat on the other side. So you're stepping up on the other leg. If you're on a stair stepper like myself, you can stay on the same side because you're going up and over. You're hitting both sides. Grab water. Remember, 8 glasses of water a day. Every cup of alcohol and caffeine, you need an additional glass of water to be hydrated. How do you get in all that water? Well, we will discuss it in a few minutes here, but we've got about 15 seconds, so I want you to get set up. I'm going to count you in. Same exercise, final set in the frontal plane. 100% effort, counting you in. 5, 4, 3, 2, 1. Here we go. Let's give it all you got. 1 minute on the clock. And as you're going, I'm going to remind you of the best way, if weight loss is a goal post-pregnancy for you, to get your water in and to also downsize those portions so that you lose those few pounds that I'm sure you would like to lose. Always have 2 glasses of water with you when you're eating, and make sure they don't have ice so that you can really throw back that water. Every 10 bites of food you take, you have to take 10 sips of water. Don't take any more than 10 bites of food without following it up with 10 sips of water. You'll be surprised how slowly you'll begin to eat and how you'll get full and your portion sizes will really decrease. This will help your waistline, help you feel full, and give you a lot of mental clarity because you won't be overeating. Counting you down. 5, 4, 3, 2, 1. Take your 50-second break. While you're taking your break, I'm going to remind you of the transverse plane exercise. We're holding the 3-pound weight and we are lifting it up chest height, not above the shoulders, as we turn in the transverse plane. Watch me. Please don't do this exercise. I want your heart rate to go down. This is all about spiking the heart rate up, so you need your breaks. Don't sit down, though. You can take a stretch. You can grab water. Okay, you know the exercise now. We have another 20 seconds, so use it to take water, to stand still. Don't lock your knees out. And remember, when you step up onto that box, knees must remain soft. So you're standing profile of the box, then you're standing straight on the box. So think about, I'm going to count you in. 5, 4, 3, 2, 1. Here we go. 1 minute on the clock. First set in the transverse plane. As you step up onto that box, think about being at 12 o'clock. When you turn, you're then at 3 o'clock. You turn back, you're at 12 o'clock. You turn again, you're at 9 o'clock. So your profile to the box, you're standing straight on the box. Your profile to the box, so that's what it should look like. Keep going. Keep breathing. You're doing wonderful work. Think about how great you're going to feel after this, knowing that you took care of your heart health, your stress management. Push yourself. 100% effort means you barely can finish the set because you're really giving it all you got. Channel all the energy you have right now. 15 seconds. Think about your baby and how healthy you want to be for them as they grow up. Keep going. Push yourself. You've got this. 5, 4, 3, 2, 1. Take your break. While you're taking your break, feel free to take a stretch, anything that feels like it needs a stretch. And if you find when you're lifting that weight, lifting and lowering it, that it's too much on the front of the shoulders, you can hold it on the chest like we did in level 1. That's perfectly fine. I don't want any straining in the front of the shoulders. Right now, perhaps is a time to take a chest stretch against the wall. You can do your wall V if it's the front of the shoulder. If it's more of the chest, you can do your cactus or your T, twisting away from the arm, making sure that we don't strain our front body as we're trying to work the back, abs, and sculpt those legs. Okay, counting you in. Second set in the transverse plane. 5, 4, 3, 2, 1. Here we go. 100% effort. Give it all you got. Final set in the transverse plane. So let's make it count. Let's give it all we have. Hearing our breath, thinking about what we're doing, moving consciously with awareness, facing center, facing profile, thinking about that 12 o'clock, 3 o'clock, 9 o'clock mark, and our legs being parallel, our feet being parallel, our knees being soft. Tracking and alignment is really important. So focus on form. You're going to feel a burn in those thighs, outer thighs, as you have to step up against that resistance. We're going to work on knee traction here. Keep the chin up. Gaze soft. Plug the shoulders down. Imagine hands on your shoulder blades. Fight for the back ribs to reach those hands. You're doing great. Almost there. 5, 4, 3, 2, 1. Take your 50-second break. While you're taking your break, I'm going to show you your final exercise. We had our green loop band and our 3-pound weight. We start with the band. We start with the weight in our dominant hand, the wrist through the band. And remember, whatever hand has the weight, it's the opposite leg that steps up first, and that same leg steps down first. So watch me. I'm going up, right, left with my legs. Right, left, because my left arm is loaded. If you're right-handed, you'll do the opposite. Your right hand will be loaded, and you'll go left, right. So whatever leg steps up, steps down. We'll switch on the second set, so no need to worry about it. You do not need to switch in the middle. Stay on the same side for a full minute. Setting up, counting you in. 5, 4, 3, 2, here we go. 1. 1 minute on the clock. Full minute. I want to see 100% effort. Don't shortchange yourself. This is your time. You're doing what the Heart Association says is the bare minimum for heart health, and that is, well, you're doing a little more than that, somewhere between 4 to 8 minutes of 100% effort cardio burst. And they recommend you do this 3 times a week. So you're getting it in today. Mark your calendar for 2 more cardio bursts, okay? 2 more. And once you get the go-ahead from your doctor and you're clear, you can explore all of our other cardio options. This is a safe one, though, postnatally. And I just want to keep your abdomen safe, especially if you had a C-section and you're worried about your rectus abdominis splitting. We've got 10 more seconds here. Keep pushing yourself, 100% effort. Counting you down. 5, 4, 3, 2, 1. Take your 50-second break. In 50 seconds, we will do our final burst, okay? Same exercise, but you need to switch the weight in your hand and you need to switch your leading leg. So now I'm loading my right hand, which means I'm going to go up, left, right, down, left, right with my legs. Up, left, right, down, left, right. So we have that opposition feeling. So it's a challenge. The arms are both lifting up, so it's really just a matter of feeling those abs supporting the movement under you. Okay. You got another 10 seconds, so grab your water, take your stretch, and I'm going to count you in. And 5, 4, 3, 2, 1. Here we go. 1 minute on the clock. Give me all you got. This is it. 1 minute to go. How hard can you push? Push yourself. You have this. Just up and down, up and down. Keep it going. Remember, soft bend in the knees. Focus up higher than eye level. Imaginary hands on your shoulder blades. Bring the back ribs into those hands. Firm your belly. Fight for a neutral pelvis. Nice parallel legs. Don't let those feet turn in or out. Push through the inner and outer edge of your feet. Brace your abs in towards your spine. Lift up on the muscles that stop your stream of pee, those Kegels. Plug the shoulders down. Don't let the hands go up higher than the shoulders. Pull out on that band. Feel the adductors of the arms, those triceps, posterior delts engaging. Counting you down. 5, 4, 3, 2, 1. Great job. Let's come over to the wall. We'll begin with a pec minor stretch, bringing our dominant arm into a cactus. You'll twist away from this arm, leaning forward slightly, but still bracing your abdominals, keeping a neutral pelvis. Subtle twist away from the wall, stepping the same leg, same side of the body as the arm on the wall back. Keep your pelvis profile to the wall, while your torso will do a subtle twist away. You can lean forward a little bit to get deeper into the front of the shoulder and chest while we stretch out the calf muscle here. We're breathing, inhaling laterally into the side body, pulling the belly in towards the spine, and lifting in and up on those muscles that stop your stream of pee to condition your transverse abdominis. Bracing those abdominals, we exhale. Again, inhale laterally, 2, 3, 4, belly in, hold it in, tug in and up on the muscles that stop your stream of pee, contract them, and exhale, 2, 3, 4. Slowly turning around, switching sides, setting up for your upper body stretch, stepping the same leg as the arm on the wall back slowly. Deep bend in the front knee, equal pressure between the toes, focus of the eyes up higher than eye level. Pelvis is profiled to the wall, torso is subtly twisting away, leaning forward, opening up the shoulder, chest. Let's breathe together. Inhale, 2, 3, 4, 5. Belly towards the spine. Lift in and up on the muscles that stop your stream of pee. Contract and exhale. Again, inhale, 2, 3, 4. Belly in. Tug up on the muscles that stop your stream of pee. Sustain that Darth Vader breath. Inhale, 2, 3, 4. Belly towards the spine. Contract, lifting in and up on the muscles that stop your stream of pee. Fog a mirror with that exhale. Slowly turning back to center. Take a moment to grab a chair. If the chair is a little short or tall for you, grab a yoga block or bolster. My chair is a little tall for me, so I place the yoga block under my front foot so it's solidly on the ground. My dominant leg goes back first. I come into a supported chair psoas stretch, opening up the back legs, hip flexors. Again, take the same arm as my back leg up in the air to shoulder flexion, plugging my shoulders down, chin up, gaze soft. From here, subtle lateral flexion, bending towards the top of the chair, plugging the shoulders down, watching out for leaning forward, but instead a subtle arch back. Chin lifted, gaze soft. And if side bending here, even in this subtle bend, is too much, just stay lifted through your abdominals, kegling, and keep the outside arm up in shoulder flexion, holding it there. Deep breaths. Keep breathing here. Again, inhale, 2, 3, 4, belly to spine. Kegel, sustain it, and exhale, 2, 3, 4. Inhale, 2, 3, 4. Kegel, sustain it for the duration of your. One more. Inhale, 2, 3, 4. Kegel, sustain it, and ocean breath. Turning around, taking it to the other side. Chair psoas stretch. Postural important stretch as you are recovering postnatally. Hold it here. Inhale, 2, 3, 4. Kegel, sustain, and ocean breath. Inhale, 2, 3, 4. Shoulders plugged down. Darth Vader. Keep going with that breath. Keep your chin lifted, gaze soft, eyes higher than eye level. Imagine my hands hovering from your shoulder blades. Puff your back ribs towards my hands, engaging the upper back. Press heavily through the front foot on the inner and outer edge, heel and toes. Make sure that the back leg's foot is not solidly planted, that the heel is up and you're just on the metatarsals. One more breath here. Setting the chair to the side. Picking up our foam roller, coming into a forearm plank to roll out the front of our thighs. Legs can be hip distance apart if you have knee or back issues, together if not. Point your toes as you're rolling, unless you had flat back posture prior, and you can dorsiflex your feet as you're rolling in this case. So plantar flexion is pointing, looks like this. Dorsiflexion is flexing the toes towards the face, looks like this. Everybody should be plantar flexing unless you are certain you had flat back posture prior to pregnancy. Keep going here. Give me 20 more seconds rolling out that tight fascia. Breathing into it. Beautiful. Inhale, 2, 3, 4. Kegel, and exhale, 2, 3, 4. Don't lose the lift of the Kegel, so sustain the Kegel for the duration of your exhale. Let's now rise up onto our knees, and we'll grab our black Theraband, taking it behind our shoulder blades and under our armpits, wrapping it around the knuckles. I'm going to come profile to you for thigh stretch so you see what's happening. So we're going to create a diagonal from the knees out through the crown of the head. Just watch for the first set. I'm going to inhale. I'm going to keep a neutral pelvis somewhere between rounding and arching, brace my abdominals, hinging back, puffing my back ribs into this band to engage my upper back. So we're not doing the yoga pose where your upper back and your low back arch. We're creating a diagonal to stretch out the top of the thighs. Let's do it together. Inhale at the top, no movement except feeling as if the pelvis is being pulled towards the knees. Exhale, let your inner thighs pull you back into your thigh stretch. Hold it here. Inhale 1, breathe. Exhale 1. And inhale back up to center. Now, if you do have knee or back issues, keep your knees hip distance apart. And they can be a little closer. They shouldn't be all the way together. No matter what, there should be some space. Hip distance apart is ideal. Let's hold. Here we go. Inhale, prepare. Exhale, hinging back. Hold it back. Inhale 1, breathe. Exhale, let the inner thighs pull you back a little more. And inhale, pelvis grounds down towards the knees as you come up. Let's hold for 2 breaths. Exhale, let your inner thighs pull you back. Hold. Inhale, pelvis grounds down. Exhale, inner thighs pull back as you turn your head right and left, right and left. Inhale, pelvis grounds down, staying down. Exhale, inner thighs pull you a little deeper back, and we turn our head. 2, 3, 4. Inhale, center, all the way back up, standing on the knees. Grab a trigger ball. If you don't have a trigger ball, you can always use your foam roller. Trigger ball would be a lacrosse ball, tennis ball. Also grab your small anti-burst ball to place under the side of the head. Start with your dominant leg as your top leg stacked, and it will drop over, rolling out the posterior tibialis, which is located here. I'll show you where it is. Get into that fascia. Right around the knee can be pretty sensitive if you've had any tracking issues. And with the new load, the increased load from giving birth, there's definitely shifts in your balance in your body, and the knees can take a lot of that on. So we want to reset them. So rolling that posterior tibialis area out, getting into that, and breathing. Now, if you feel like you've gotten that, you can go above the knee, right above the knee medially in this area, in this pocket, and dig into that area. Breathing, being as aggressive as you can to really get some of those knots out. Just another 15 seconds here. Really dig in, push into that. Circular motions back and forth, or just pressure down. Make sure you're breathing. Your abs are still pulling in towards your spine. From here, option to stay where you are. You can go back to the posterior tibialis, stay above the knee, or you can go to the posterior delts. This divot between the tricep and delts, you're going to go around that fascia in the tricep and delt area. So it's your bottom arm that you'll be rolling. So plug your shoulders down. Try to not lean back too much. Stay stacked. That'll apply a lot of pressure. Your arm can reach forward and back, forward and back. So play around with that. Really allowing yourself to do circular motions. I find that just forward and back, getting into that fascia, there's a lot of tight knots there. So I'm going to breathe into that. And again, you can stay in one area. You don't have to hit an area that doesn't feel like it needs it. So we've hit 3 areas rolling. And you can do this against a wall when you're doing the upper body with your roller or ball if side lying is too much pressure. So you can stand. I'll stand up and show you against the wall. Roll it out. Our final spot, I'll show you standing, but you can do it side lying if you'd like, is our lat, which attaches under the armpit. So you can raise your arm up and down like you would in a classroom. It's posteriorly, which means behind and under the armpit. And you'll get into that pocket. You can do it side lying. If you do it side lying, you may want a yoga block or pillow on your bicep to rest your head. So I'll hop down just to show you real fast. So I showed you on the wall. Now I'll show you on the floor with the roller. And the trigger ball, obviously, you put right in that pocket as well. So digging into that area, really getting those knots out, breathing. We'll be here for another 20 seconds. Hang in there. Push yourself through it. So maybe the lats don't need as much attention as the posterior delts, or maybe the posterior tibialis is where you need to direct all your attention, or above the knee, which can help alleviate back and upper knee pain. Couple more breaths. Okay, let's spin around slowly to the other side, starting below the knee with the posterior tibialis. Support your head with that ball, block, or bolster. Breathing here, evening out the body. For some, their non-dominant side will be more sensitive because there's more tracking issues. For others, if you really overuse your dominant side, it can actually have, some very big knots because of overuse. So there's different reasons why one side is tighter than the other. No need to analyze. Let's just get those knots out. Now, if you feel like you've gotten the posterior tibialis, you can move above the knee medially, or you can stay with the posterior tibialis. Listen to your body. Only you know what you need right now. Keep breathing. Keep rolling. Again, you could have the roller and do this, trigger ball, tennis ball, lacrosse ball is what I'm using as a trigger ball. Now, if you want to move to the posterior delt, remember, the tricep posterior delt is your bottom arm. Plug the shoulders down. Watch out for rocking back. Stack your body, your hips, your torso, nice and parallel facing me in a line. If that's too much pressure, come to standing and go against the wall and roll it out from a standing position. Again, the foam roller will work from the standing position or the side lying. If you're using it for the side lying, make sure you have a block. I'll show you under your bicep just to rest the head on. Plug the shoulders down so you can breathe into that. Option to move to the lat. Remember, the lat is attached under the armpit posteriorly. I'll show you. You can get into that fascia standing using the roller or ball or side lying. And as you do it, you can twist forward and back. Plug the shoulders down. Make sure you're breathing. We don't want to hold the breath. Okay, for our last 30 seconds here, or 15 seconds rather, for our last 15 seconds, let's breathe together. Inhale, 2, 3, 4, and exhale, 2, 3, 4. One more. Inhale, 2, 3, 4, and exhale, 2, 3, 4. Final stretch. Bring your yoga mat by the wall. We're going to do legs up the wall, straight, just to open up those hamstrings after all that strength work. And depending on your posture prior to pregnancy, the hamstrings could be a posturally tight area that needs some attention as well. So once you get the legs up the wall, take one hand under your low back, check out the pelvic position, see if you can neutralize it. So somewhere between rounding and flattening it into the floor and arching, a big mouse hole. So we want that in-between position. Make sure you're breathing. Use that breath. And then from here, option to dorsiflex the feet evenly without locking out in the knees. Close your eyes. And let's come back to our TVA breathing to recondition the pelvic floor. Okay, one hand on the rib cage, one hand on the belly. We inhale laterally through the nose or mouth into the side body, expanding it. Our belly is pulled in towards the spine. So we hold the breath. We lift up on the muscles that stop the stream of pee. And now that's an internal lift, like it's a Kegel. You sustain that Kegel and pull in action of your belly for the duration of your exhale. Fog a mirror with it. Again, inhale laterally, belly in, tug in and up on the muscles that stop your stream of pee. Darth Vader. Inhale, 2, 3, 4, contract and sustain. Exhale, 2, 3, 4. Inhale, 2, 3, 4, contract, sustain it, and exhale, 2, 3, 4. Two more. Inhale, 2, 3, 4, belly to spine, Kegel, and exhale, 2, 3, 4. Last one. Inhale, 2, 3, 4, belly to spine, Kegel, sustain it, and exhale, 2, 3, 4. Subtle bend in the knees. Slowly make your way off the wall to a comfortable seated position. Breathing, keeping the abs braced as you do this. Whatever this position is, let's roll our shoulders back, keeping our chin up, gaze higher than eye level for 5 and 4, sitting tall on the top of the sits bones, 3, 2, and 1. Great job.